My name is Dr. Dingle, and today I'm going to talk you through our project looking at risk prediction and long-term outcomes from a shared decision-making clinic. Shared decision-making clinics are increasingly utilised throughout the NHS for high-risk surgical patients, with the benefits allowing discussion between patient and clinician about the potential risks and the impact that surgery may have on quality of life versus their current state, ultimately empowering patients and allowing appropriate utilisation of NHS resources. We analysed the 2-year outcomes of the first 100 clinic patients to pass through our high-risk anaesthetic service that was instigated in 2018. And as you can see, we ended up with a median age of 74, a fairly even split between male and female patients, but a predominantly orthopaedic population at 72%. In terms of the data that we found, as you can see, the flow chart at the top shows the 100 patients that we had, and you can see that those fell into the groups of proceed, defer, this was for further investigation and management of their underlying comorbidities, or cancel. If you follow that down even further, you can see that within those subgroups we had patients who, irrespective of the initial decision, went on to either have surgery or decline. The bottom table shows our predicted versus actual post-op mortality, and then our long-term 2-year follow-up mortality. And as you can see, both in the surgical and non-surgical groups, there were fairly variable predictions of mortality, but the average of 1% was similar across the board. In terms of the actual 30-day post-op mortality, we had no patients passing away within 30 days, although we acknowledge that this is a relatively small sample size. Mortality at 2-year follow-up was 15.6% and 19.4% respectively. We also had an average time from clinic to date of death in the surgical group of 626 days versus 613 in the non-surgical group. The average time from operation to date of death was 495 days. In terms of our conclusions from this, average hospital length of stay was 5.7 days. We had 21 patients admitted to HDU and ICU post-op, which averaged about 0.36 ICU bed days per operation. With an estimated cost of around £857 a night for a level 2 bed. If we look at those patients who were high risk and cancelled, this suggests a possible financial saving around £24,510. Overall, we feel that shared decision-making clinics are a vital tool in high-risk patient groups, and we acknowledge that our 30-day mortality predictions were very variable, and subsequently we're reviewing our risk scoring strategy. Thank you.